recorded. And that's a recording will be shared to everybody who registered so they can watch back. We will stop the recording at the question and answer phase, just so we can have a slightly freer discussion. There is an opportunity to ask questions, and if I could ask, if you do have a question, to pop it in the chat box. And Rory is our integration projects manager. Rory and I will be looking at the questions and we'll be passing them across to the speakers after everybody has presented. But if you have a question, best to pop it in the chat, and then we can keep an eye on it and put it to the speakers at the end. We have 6 fantastic speakers with us today. 5 presentations, and I'm really grateful to them for coming today and talking to us about this really important subject. What I'm going to do, though, before we pass across, and you can see the running order on your screen, but before we pass across to Paula to kick it off, I thought it might be useful for us to just give a little summary of the current situation in direct provision. That is that there is nearly 7,000 people.
Everybody has their audio on. Can everybody please mute themselves? Thank you.
Thanks, Rory. That is more than 7,000 people in direct provision and emergency accommodation. Nearly 1,800 people, unrelated single people sharing a bedroom. And in terms of waiting periods before the International Protection Office, if you claimed asylum today and your application wasn't prioritized, you'd be likely waiting 22 months for a decision. The average length of stay in median length of stay, in direct provision is 27 months and 17 months in emergency accommodation. And there's currently around 5,200 people backlogged before the International Protection Office. Those figures, I believe, speak for themselves and summarize that the situation as is not in a good place whatsoever, and the need to end direct provision and implement reforms to the international and changes to the international protection process is as urgent as ever. So having given that snapshot, I thought we could just talk very briefly about developments since the publication of the government's white paper in February 2021. And this information is really just gleaned from parliamentary questions that we know of and that have been made and answered in the Doyle. The first development is that there is apparently a program board that has been established, and that will comprise government department officials, NGOs, people with lived experience of direct provision, and independent experts. And that the role of the program board will be to advise, provide information exchange, and monitor the government's plans and implementation of the end of direct provision. In addition to that, there is apparently the City and County Managers Association is working on an allocation key, which will determine the number of international protection applicants to be accommodated in each local authority area. And apparently this will take into account of people's needs, population density, housing needs, and the availability of public services. Inspections is something that's mentioned in the government's white paper. There are inspections currently taking place, but these are quite limited, and we and other organizations have criticized the scope of inspection. There have apparently been 19 inspections so far in 2021. HICWA is the crucial and important body that has been proposed as a new inspectorate, and it is, we understand that, and well, Minister Roderick O'Gorman has said in the Dáil that it is intended that HICWA will begin its role shortly, but we don't know any more information than that. Vulnerability assessments, again, an important part of the white paper, but again, really rather limited number of inspections that commenced in a pilot capacity since December 2020, 165 assessments complete as of April 2021, and 97% of people identified as vulnerable so far. There is also, and there was media around this last week, there's also a government intention to end the use of emergency accommodation. There's a statement that emergency accommodation will be decommissioned by the end of 2021. I'm not sure whether that statement really is just a repeat of what was in the government white paper in February, or whether there has been a new commitment since then. I think it's the former, and that's what I said when we did some media on this last week. What wasn't mentioned in the white paper, but is still quite relevant, and some of our speakers may touch on this, is the Land Development Agency. There's a bill that will overhaul the scope of that body and put it on a statutory footing. And it's of note that we made representations about including the provision of a protection accommodation in that organisation's mandate. Deputy Owen O'Brien made a similar amendment. I understand, looking at the DOR records, that wasn't taken forward by Dara O'Brien, the Housing Minister, but would be considered at a committee or report stage. But I think it's just passed out of committee stage today. And then finally, we did a piece of work in May around analysing what was said in the advisory group report from October 2020 and what was in the white paper. And it does say, our findings are that quite a significant number of recommendations of the advisory group weren't taken forward and implemented in the white paper, and those recommendations tended to fall at the responsibility of the Department of Justice, and that has been acknowledged by us and others is problematic. So that's a little snapshot. I'm going to stop talking now, and I hope it was useful just to bring us a bit up to speed, and I'm going to pass this across to Orla. And Orla is an academic, an architect at UCD, and Orla also gave us assistance and insight and expertise into the report that we produced in January of this year. So Orla, thank you very much again, and I'm going to pass across to you, and you may want to share your slides.
Thank you very much, Nick. Thank you for the introduction. I think it sets the scene quite well. I think when people look at the numbers, maybe we can be a bit concerned that it seems like a lot of people to house, and particularly in the context of there being very long housing lists in local authorities, that can feel like an intractable problem, and that the speed of resolving this is going to be one of the challenges. So rather than talk more broadly, I think I'd like to set a scene more specifically, maybe bring a bit of vision to how we can deal with this, and how I think with a different approach, maybe that with a more integration across other areas of government policy, that we can lever some other benefits. Because ultimately this is really about making communities so that people can put down roots, they can become established, they can become integrated, that they can be socially supported in soft ways, integrate with employment and education, and importantly that the human side of this isn't forgotten. Just looking at numbers, sometimes you can forget that people have day-to-day lives and health and relationships, and that these things are all part of a housing response as well. So I think to set some objectives, I think social integration should be really high on the list. Isolating people in locations where they're, sorry, let me just switch that to the slideshow. Okay, so in terms of objectives, I think social integration should be really important, not just for people's well-being, but also for broader political and social issues that can arise by isolating people, and also so that a lot of the support for people doesn't fall on the state. When people build their own relationships and are part of a community, they can be more self-reliant, and the people around them can support them. I think quality has to be really important. We have to house people properly. Again, that's to do with their health and well-being and their integration. We need to prioritize, I think, speed and cost efficiency in this, rather than allocating large amounts of money to a property-based response, that there's some due diligence done about value for money. And then to take opportunities to align the response with other policies and look for opportunities for other benefits along the way, because I think there can be many. So what does that mean? I think firstly, we need to stop looking at it as putting people in boxes. We have to have a human response. And a lot of the response to date has been to tick boxes, I suppose, and move people around at will, and to put them in locations that are not suitable, and where maybe supports aren't adequately available to them. And I noted the comment earlier about a lot of people sharing bedrooms. Again, that can be very difficult, but it's also a health issue. We're in a pandemic. People who aren't the same household should not be sharing bedrooms at the moment, particularly when people are going out into employment and into other settings during the day. So we need to think about the people in all of this response. Yeah, I'm going to focus primarily on Model 1, which is in the report, and this is the model that looks at I suppose what you might call a community-led response that levers what we have. So it's really a response about using what we have to solve a problem or a challenge that we have, and to lever the most benefits with the response that's there. So doing something efficient. So without going into the detail of that, I think the model really is about a grounds up approach. So it's about using the strengths that are there at the moment. There are many communities in Ireland that have responded very well to direct provision and to people in international protection in their communities, with informal supports, with employment, with integrating children into schools, with language and sport, and all of the other cultural aspects that have allowed people to become part of a community. So I think we shouldn't forget that there has been a very good response in some communities in Ireland that can be built upon. Secondly, I think to lever other policies, we have a planning policy about compact growth so that we use our towns and brownfield sites better. We have policies about urban regeneration. We have policies about energy retrofit in buildings and financial supports for that. And we want to reinforce our regional and rural communities with additional population in places, particularly to support schools to stay open. We also want, I think, that people who are housed out of direct provision, that the housing is flexible on the one hand, so that it can maybe meet the needs of somebody for a few months or a year, but it's long term on the other hand, so that if people do integrate into a community and find housing that is suitable and want to stay, that there's some flexibility in the system so that they're not moved and having to start all over again. So where do we start? I think vacancy is opportunity. The picture on the top left there is North Main Street in Cork. There was a study done on that a few years ago that found it had about 300 people living in the upper floors, but that there was capacity for 3 times that. So nearly 1,000 people could have been accommodated within the existing building stock that was not properly in use. A similar study in Dublin city centre between the canals found that there was capacity in the upper floors for 4,000 apartments or 10,000 people to be accommodated. And that's repeated in every suburb and regional town and village around Ireland. There is enormous amounts of vacancy. We've had a whole generation of people moving to edge of town, new build homes and bungalow bliss in some places, and the existing housing stock being left vacant, and commercial buildings be left vacant in towns. So there's enormous opportunity there. So the numbers, when you're looking at something on the scale of 5,000 people or so to be housed, and you spread that out around the country, it's actually a very small impact in communities. This can make really quality housing. These 2 other images here are in Camden Street in Dublin, and it's an over the shop and over the restaurant conversion into housing. And again, it can be very attractive housing. It can also has the advantage of being in areas where there is infrastructure, so it doesn't need to wait for electricity and drainage and broadband. These places have bus routes already, they have shops, and when people come out their front door, they are part of something. They can go to the local shop, they can go to the library, children can walk to school, they can get a bus into a town for a hospital appointment or whatever else is needed. So areas that have good infrastructure at the moment in our towns immediately provide a lot of soft support to people so that they can use existing public transport, existing schools, and they are in centres of employment as well, which gives opportunity for people to become, to become known and to see where the jobs are going locally, and to find employment. So I think primarily there's a huge opportunity here. It's also quicker than new build, and as I said, energy grants are available to upgrade buildings now as well. So there's a possibility of levering some financial support. The pandemic has probably thrown up another opportunity, in that a lot of the people who have these shops and restaurants on our main streets and in towns and suburbs have had a very difficult year with their businesses being closed. So whereas before they might have been storing boxes on the upper floors, it might be very attractive to them now to have an income stream over the future. And there is a repair and lease scheme from the Department of Housing which could plug into that, whereby people can access funding for doing some repairs, and then they can have a 4-year lease from the local authority for social housing tenants. So you can immediately see that doing the work up front and paying for it over time could be a good option there. And the side benefit then, of course, being that it'll bring life and activity back into towns, which makes the streets safer, has greater footfall in the shops, keeps children in schools maybe so that they can keep a teacher, and makes the place a lot more attractive for tourists when buildings are painted and well maintained. So what could a million do? I think I would like to suggest that we have an open call to towns and communities around Ireland with a response of $1 million each, to say, this is what's on offer. Do you want to put your town forward? Let communities come forward. What could $1 million do in a town? It could probably convert 15 or 20 homes in this kind of setting over the shop or in vacant buildings. And that's in comparison to it only building 4 new building purpose-built homes, or 3 turnkey homes, or in Dublin at the moment only 1 urban apartment from a developer in 1 situation. So it's a really good way, I think, of getting value for money and doing the work quickly. The other advantage, to go back, the other advantage of $1 million into a town is that it is local, regional construction employment at a time when that is really badly needed. Emigration isn't really an option for builders at the moment. Commuting around the country is a lot more difficult, and we won't be building a lot of offices and hotels in Dublin in the next few years. So people will need employment, and they will need regional employment, and that can lever apprenticeships and things locally. So that puts a lot of money into a town. It also puts footfall into the shops when these 15 or 20 homes are inhabited, and it may keep a teacher in the local school, or it may justify having a public health nurse in the area to support that new community and the others in the community as well. So a lot of benefits. This is an example, I suppose, of what can be done. It's a Dublin Civic Trust building on the North Quays that has just received an award in Europe as a Heritage Award for this conversion. So these buildings can be very, very attractive places to live, even if they don't look very attractive at the moment. There's enormous potential there in making nice homes, and more importantly, small developments whereby people know their neighbours, and there's a level of integration rather than being in large anonymous blocks where there's a throughput and it becomes quite transient. So what can regeneration do? It can give us integrated housing, but it can do it incrementally and very quickly. So lots of small solutions all happening in parallel rather than waiting for one big bang on a greenfield site. It can be done in places that have existing infrastructure and capacity in those infrastructures. So there's lots of capacity in schools in lots of places, even in inner city Dublin schools, there's capacity when the commuter belt is under pressure. And as I said, public transport, hospitals being accessible, and other community supports like libraries and religious buildings and community halls and sports facilities and teams and everything else that will help people to become part of a community. It's also a lever to support existing owners of commercial buildings or of vacant property at a time when they probably need it. It allows us to further our national policies for climate adaptation by using energy retrofit and plugging into the energy retrofit programme. It's an opportunity, as I said, for regional jobs and for supporting regional schools. So that's, I suppose, an overview of how I see we might do it. I think obviously there's going to be lots of other solutions on the table too, in terms of new build and shorter term accommodation. The advantage I think of this one is that it doesn't compete with everybody else. One of the challenges I think to a replacement for direct provision will be that it is seen in competition to people looking for social housing, to AHBs looking for sites, and you know, all of the other competition for resources that is there. And they're legitimate concerns. You know, there are people 10 years on housing waiting lists, and it is legitimate for them to think, are they, you know, is the queue being jumped by somebody else? I think by opening up a new stream of delivery of housing or a possibility, we can maybe remove some of that negative view that replacing direct provision will, you know, outcompete maybe some other people who are also deserving of housing, and that it might be seen as, you know, coming from the bottom up as a community welcoming new families and individuals, rather than a top-down approach of government imposing imposing people on communities, and that being seen as a drain, but rather that it would be seen as a benefit. Thank you.
That was fantastic, Ola. Thank you so much. Vision, optimism, ideas. It was really fantastic. Just a reminder to everybody that if you have any questions, just pop them in the chat and we'll try and get to them at the end. We're going to move now to Julie and John from the Housing Agency. Rory is going to manage their slides. So Julie and John, when you're ready, you can take it away.
Thank you very much, Nick, and thank you very much for the invitation, and good afternoon, everyone. Firstly, if I could comment that I fully support what Orla said and Orla's suggestion in terms of focusing on urban, you know, and town regeneration and village regeneration, and there is a large number of homes potentially available that gives, you know, full integration and involves the community. So I absolutely support that idea, and any support that the Housing Agency can provide to that, we'll do so. Just for those who don't know the Housing Agency, we're a government agency, and we mainly work with local authorities throughout the country, the approved housing bodies, and the Department of Housing, Local Government and Heritage in relation to provision of social housing and social housing support and affordable housing. So we do a lot of work right across the housing spectrum. The Housing Agency's role, just very broadly in relation to international protection, is we're supporting and advising the Department of Children, Equality, Disability, Integration and Youth in relation to setting up a new system, a new funding system, both for the provision of housing and for the support of that housing. And success from the Housing Agency's perspective is if we can help to make the system work, we can support the non-governmental organisations, the NGOs, support the approved housing bodies, support all of you who are working to make a difference in this area. So that's success for us, is if you're successful, and supporting organisations like the Irish Refugee Council, supporting the Paul Trust. So just maybe go on to the next slide, please. The one really important thing, and Orla spoke about it, is about integration and social integration. You know, that any newcomers, anybody coming to Ireland, that the quality of life that they have here, that they're integrated into the community, part of the community. They can use facilities, use schools, have employment. That, you know, we're welcoming to anyone who comes to the country, and that should be our objective. And I'll give you my own experience from many years ago. I went to work in Sweden, and probably Sweden were better then than maybe they are today. But as a newcomer to Sweden, they provided a lot of support. So I was working in the construction industry on a building site. They made available community meetings, you know, community facilities that you could meet others and integrate. You could avail of free lessons, you know, to learn Swedish, you know, which I availed of. But they've worked right from day one in terms of providing supports for you to integrate into the community, and they ran events and other things, you know, to integrate you. And also the employer, again, because it must be in a philosophy, again, the employer encouraged you to get involved in various activities, and these were mainly aimed at people that had come from outside the country. So we should take the same approach in Ireland. Anyone who's coming to Ireland, we should welcome them and help them to integrate and have a good life for whatever period, whether they're here short term or long term. I'm going to hand over to my colleague Julie, who will take you through the rest of the presentation.
Thanks, John. And next slide there, Robert, if you don't mind. John has covered somewhat the role of the housing agency, and I suppose I just want to take you very briefly through what's in the white paper regarding the housing agency. Our main area of activity will be to provide advice on sourcing, delivering and management of housing and accommodation for the new model. In addition, we can also provide guidance on other support needs that may be identified for individuals and families. Where required, we can have a role in providing direct assistance with the delivery of housing, accommodation and technical supports on projects. I suppose that would be, you know, in line with what the Department of Children and the sector needs. Next slide there, Robert. I'm going to run through some of our, I suppose, 5 preliminary ideas that we have about the new model when we look to see what it will need to address. I suppose the first is around the funding and capacity building of the approved housing body and not-for-profit sectors. These sectors will be crucial to realising the vision of the white paper. To deliver the accommodation, new mechanisms will be needed for approved housing bodies to fund the ongoing costs of delivering and managing the accommodations. One initial thought has been to examine existing funding schemes for social housing to see how they could be replicated and, if required, modified to suit the requirements of delivering international protection or accommodation. This is also one of the recommendations contained in the IRC report on implementing alternatives to direct provision. Consideration is also needed on how to build capacity in the approved housing body sector to respond to the new area of activity. The sector is already committed to responding to the demand for social housing and involvement in the new cost rental initiatives. We need to build in supports to help the sector to expand without impacting on their existing programs. Some initial discussions have included considerations around seed funding for approved housing bodies and the need to proactively engage with the sector at as early a stage as possible to identify what is required to allow them to get involved in this new area of activity. The second topic is around the importance of integration with local communities, and both Orla and John have touched on it. While we are all aware of the difficulties which have arisen in local communities around the placement of direct provision centres, without community buy-in, the delivery of both phase 1 and phase 2 accommodation may face difficulties. The supports available for individuals and families to integrate should be visible, easy to access, and assist both local communities and their new residents. There are positive examples of effective community engagement in Ireland, where communities and applicants have gone above and beyond, for instance, in the resettlement of Syrian refugees. We need to build on the experience of effective interventions of stakeholders currently involved in supporting applicants. And we can also look to learnings from the social housing sector around the integration of migrants into housing options, and from initiatives focused on providing accommodation for vulnerable groups. Next, I'd like to talk about local coordination. The white paper looks to establish interagency working groups on a county basis, modelled on existing groups working with the Irish Refugee Protection Programme, who are involved in the resettlement of programme refugees in Ireland. It is envisioned that the groups will be chaired by local authorities. These groups will have an important role to coordinate supports to applicants and their families who are moving into accommodations. They'll also be the communication link between the Department of Children and local communities regarding the development of accommodation options in their areas. We'd also like to look at what role those groups could possibly play in identifying new opportunities, similar to what Orla was saying about bringing proposals to the table and also liaising with social housing providers in the area, just to mitigate any risk of competition on the same properties in the locations. The fourth area I'd like to discuss relates to the movement of applicants through accommodations. On initial examination, there are a few potential pinch points which could occur if not proactively managed. Firstly, where there are peaks in demand for phase 1 reception and integration centres, consideration should be given to building in extra capacity to handle any minor increases in demand, and a contingency planning piece for those years where larger peaks might occur to minimise any potential reliance on the private sector in the future. Maintaining the availability of phase 2 accommodation in the community is also really important. There will not be any one sole provider of phase 2 accommodation, so an effective property management piece will be required to ensure that there's adequate supply, to monitor exits in and out of accommodation, and to maintain efficient turnaround times for reletting. Where an applicant receives a final determination on their application, whether positive or negative, there will also need to be measures put in place to manage the transition to mainstream housing options and contingency planning for those with negative decisions. This will need to work well to maintain the supply of accommodation in the community for people who are moving out of reception and integration centres. The new model also needs to take into account movement within international protection accommodations. As with the experience of the social housing sector, often a household's path through accommodation is not linear. The new model needs to look at the movement of people within the model where a placement might break down or is no longer suitable for the needs of the applicant. The last topic I'd like to discuss is the transition from international protection accommodation to mainstream housing options. There is an ideal opportunity at the moment to build synergies within the model to encourage a smooth transition for applicants into mainstream housing options. We can use this time to identify and try design out any potential barriers which might delay or negatively impact on the transition. Potential barriers could be around differences in the affordability of accommodation, how to balance applicants' choice for where they'd like to reside with the availability of accommodation, and working to ensure that the support to access mainstream housing options will be there for when the applicants need to move on. Now, that brings me to the end of our presentation, and thank you for your time.
Thank you very much, Julie and John. That was really fantastic. I know this is a significant new area for the agency, and you're already very busy. So it's great to have those ideas which you're already starting to develop and implement, and being able to present them today. I'm just going to share our original screen. Our next speaker is Bulani Mfako. Bulani is a spokesperson for Movement of Asylum Seekers Ireland. And many of you will know Bulani as a leader in this area. And I'm looking forward to hearing from him today. Really important presentation and comments I very much expect. Bulani, I don't think you have slides, so I might just let you, I'm going to stop sharing the screen and let you take it away.
Good afternoon. Thank you for inviting me. A very opportune time to reflect on the progress that has been made since last year, the publication of the Catherine Day Advisory Group report. We were anticipating, of course, the white paper, which was to be informed by the recommendations in the Catherine Day group. Some of them were taken forward and some of them weren't taken forward by the government, and we'll go over that. But I want to highlight just 6 things that stood out for me in both the Catherine Day group report and the white paper on ending the system of track provision. And the first one is really the dispersal system that was introduced in Ireland prior to when the government implemented the system of track provision. Before that, asylum seekers in Ireland could live anywhere in the country. Well, most tended to live in Dublin back then, but they were free to live anywhere in the country, and they were provided support to live anywhere in the country where they wanted to live. So if we talk about housing, for instance, they would have been provided with housing assistance on the same basis that Irish nationals are provided with housing assistance. That would be the same for welfare payments. They would have been provided with the same that Irish nationals are entitled to. And then the government introduced the dispersal system, which meant a removal of choice for an asylum seeker. The asylum seeker would go to wherever the government wanted them to go, unless, of course, the asylum seeker is not in direct provision. So you have the, if you can provide for your own accommodation and your own living expenses while the Department of Justice processes your asylum claim, which can take a long process, as you saw in the earlier statistics that were presented by Nick, you can live outside of the direct provision system. And that for us is problematic when that support is not being provided for a person to live independently outside of state provided accommodation, because it really traps people in the asylum process. We've seen people, for instance, during the pandemic, who had left the system of direct provision but lost their jobs due to COVID-19, having to go back to the system of direct provision, especially when the pandemic unemployment payment was not given to people in direct provision. So asylum seekers had no much choice other than to just go back to the system of direct provision. The concern then is the movement of asylum seekers that the new system that is proposed by the white paper actually maintains that dispersal system, that removal of choice for an asylum seeker. It treats people no differently to the way you would treat your own livestock. I often make this example that if you have a cow, you don't go and consult your cow or your dog or your sheep when you move it to another county. You just simply put it in a truck and transport it to where you need it to be. And that's how the state treats asylum seekers. They don't treat Irish people like that. The second point I wanted to make is that, of course, I've already alluded to, is that no support is really provided for person in direct provision. This was actually recommended in the Catherine Day group. The white paper does not take that recommendation forward. The white paper does not envisage a system where people would be provided with support if they are not in direct provision. I asked the minister when they organized a briefing with civil society groups whether or not people who don't avail of state-provided accommodation in the reception center would receive any support, and he said no, you would have to be in the international protection accommodation service in order to receive the income supports and other material supports that would be provided. And that again is problematic for us because it maintains state supervision over the asylum seeker, and now it only removes the private actors, that we have private contractors who would be supervising asylum seekers. Like Aramak knows all my personal details, and we're concerned there that I actually don't know how Aramak manages personal data, but they have my personal data. I don't know their data protection policies, but because they are contracted by the state, they would have access to my personal data and act as a supervisor to my day-to-day life. They provide my meals. I have to go and queue for meals in the canteen. I have to go and get my post from them. If I want very basic everyday things, like for instance, a vacuum cleaning, going back and forth about a vacuum cleaning with an iron and ironing board, very everyday things. I think that simply removing a private contractor without actually giving asylum seekers control over their day-to-day life doesn't actually end the system of direct provision for us, because it retains particular features of direct provision that have proved problematic for us over the past 20 years. The third thing that I want to highlight is, of course, that the right to work for asylum seekers remains problematic for us, because if you are an asylum seeker, have been in direct provision with a first instance decision, and have been in direct provision for 5 or 6 years, you are not allowed to work. A person who landed in Dublin 6 months ago is allowed to work. And that obviously is an injustice for us. There is no fairness there, because that person could have their decision their negative decision quashed. There are people who succeed in the appeals tribunal after many years. There are people who succeed in judicial review after many years and get some sort of protection. And the state will have denied them the right to work on the basis that they had received a first instance decision. If you go back to the Catherine Day group, that issue was considered. We had extensive deliberations on it, and it was recommended that people who are in direct provision should be given access to the labor market within 3 months if they have not had a final decision on their application. So it replaces the wording that this current policy, which is first instance decision, with a final decision, because it makes sense for us, for people who have been stuck in the system of direct provision, like the asylum seekers now today in direct provision, who have been in direct provision for years and years. And we're actually in the same position as the men who challenged the government on the right to work, the NVH case in 2017, that ruled that it's unconstitutional to forbid asylum seekers from seeking and entering gainful employment. He wouldn't work today based on the current rules. He would be excluded. And that exclusion for us is fundamentally problematic because the Supreme Court had regard to the person's fundamental human right to dignity that was undermined when they were deprived of gainful employment for a prolonged period of time. And the current arrangements do maintain situations where you can end up being stuck in direct provision for many years without the right to work, while a person who arrives at Dublin 6 months ago can actually go and work. It creates disparities amongst an already marginalized community. And so you have, for instance, people with parents with children in direct provision that they can't provide for their basic needs because the parents aren't allowed to work. And you have other parents in direct provision who can work and provide for very basic things for their children. And that, for us, is fundamentally problematic because it reflects a state that is very comfortable in drawing distinctions amongst an already marginalized community. The fourth thing I want to highlight, of course, is related to the right to work, is the poverty that people in direct provision, particularly children, experienced. Numerous reports have highlighted this. The Special Rapporteur on Child Protection highlighted it. The Faculty of Pediatrics in the College of Physicians also highlighted the poverty that children in direct provision experience. Again, the Children's Ombudsman has highlighted the negative experiences of children in direct provision. Children themselves in direct provision have highlighted the isolation and the poverty that they experience when their parents are unable to provide for their basic needs. We are coming up to the next academic year, and again, children in direct provision will be impacted by that. They were left out during the pandemic. The Irish Refugee Council and others called for the government to increase the weekly allowance for asylum seekers during the pandemic. The government refused. The Catherine Day group recommended that asylum seekers by January 2021, asylum seeking children by January 2021 should be given access to the child benefit. Again, a recommendation that the government did not implement. They have said that they will implement it after December 2024, but children are in poverty in direct provision today and need supports that aren't being provided by the state, that are less than supports that are provided to other people in the state, to other children in the state. So you cherish all children, not some of the children. That's the massive call, and it will remain so because we can't have a situation where you have a government that wants to be applauded for doing wonderful work in integrating asylum seekers, that speak about integration from day one, while you're still trapping children, asylum-seeking children in poverty. The fifth thing I wanted to highlight is, of course, that the government intends to provide self-contained accommodation for families, which is great. Post direct provision accommodation looks grand on paper for families, but when you look at the situation for single people, it still talks about, for instance, people sharing kitchens and other living spaces with strangers. They speak about up to 10 people could, for instance, share a kitchen. We have a direct provision center now that had reoccurring outbreaks of COVID-19, where asylum seekers were actually sharing kitchens and the rest of it, and other intimate living spaces. Just giving a person their own bedroom doesn't actually mean a vindication of their right to privacy and the dignity that comes with privacy, because people need to have sexual lives, for instance. It becomes very difficult when you share, when you live in close quarters with other strangers, to have that privacy, to have meaningful social experiences and sexual experiences. And so it's very difficult for us to see that kind of situation as an alternative to direct provision. But it also speaks about hosting asylum seekers in family homes in Ireland. So Irish families, anybody, for instance, in Ireland who has a spare bed could host an asylum seeker. On the surface, it looks great, but they don't provide us with guidelines on how the relationship between the two will work. Will it be a landlord and tenant relationship, which would be greater because then a person would be subject to whatever appalling tenants protection that other people in the state enjoy. But it's not so great when that relationship is not clarified in law, because it could potentially breed situations of abuse. We do know that if you live in my house, you live by my rules. And people tend to act as if they are doing you a favor when you are being hosted in those situations. There are examples, of course, where it works great for both the host and the asylum seeker who doesn't know much about the country. They might be getting help from their host, for instance, with things when it comes to applying for very basic things like a PPS card, or just knowing the bus routes. The asylum seekers, for instance, who get lost in Balsaskin. There was one who took the wrong bus. He thought he was taking a bus back to Balsaskin, and he ended up in Liffey Valley, and he couldn't speak much English. He needed to get back to Balsaskin, and he could only call a person from his country, and he had a very difficult situation of having to tell the person where he is because he didn't even know where he was. And so it becomes, it's great for the person when it works well, but it's not so great when it ends up being abusive. And so we need to ensure that there's a balance, and that relationship is clearly regulated, and that there aren't power structures that could be that abuse in that relationship, and so that there is a clear tenant and landlord relationship. Otherwise, it's useless if it is not tenant and landlord relationship on the host. We've had students, for instance, who are international students in Ireland in general, who do take hosting agreements. So there would need to be a flexibility when that relationship breaks down, and it does break down for students. I would assume that it would break down for asylum seekers and everybody else, because you're talking about mixing two personalities, different cultures. That clashes do happen, and you need to make provisions for what happens when that relationship breaks down, and also what happens when the asylum seeker refuses that type of an accommodation, because that's another issue, because the state could say you are refusing an offer that we've made to you, and therefore we won't provide you with accommodation. And so those are areas that are problematic for us. And again, on reception, it does talk about self-contained bedrooms that are not shared. You have your own door accommodation that you wouldn't be sharing with anybody else in the reception center, which is great. But again, we want to make sure that people don't spend a long time in reception. You remember that direct provision was introduced to be a short-term thing. They framed it as a short-term thing, but 20 years later, here we are with people in direct provision spending years and years. If you are saying that people will spend 4 months in the reception center, maybe you need to make a legal obligation, put it on a statutory footing that people will not spend longer than 4 months in there. Then we can actually believe that you will stick to that, because it becomes very difficult when none of these new changes that are proposed are placed on a statutory footing. The government doesn't want to make them legally binding, so they would be run on an administrative basis, just like as the system of direct provision has been run for the past 20 years, with simple bureaucrats making decisions, making changes whenever they want, and house rules that are deeply infantilizing for people in direct provision that have run our lives. The last thing I want to speak on before I shut up is of course that none of the changes that are proposed in the white paper to end direct provision will make any meaningful difference if the asylum process itself, the status determination process, isn't drastically reformed. So if you don't take up any of the recommendations around providing legal aid, around providing suitably qualified interpreters, around speeding up the decision-making process, actually making an obligation on this Irish state to issue an asylum decision, a first instance decision within 6 months, it won't work because you will still have people waiting in limbo for years and years if you don't speed up the process, if you don't provide the necessary legal support, if you don't provide the mental health support, if you don't provide supports for Spirasi, who are the only organization that provides support for survivors of torture, for instance, so that they could provide the medical legal report that assists people in setting out their asylum claim. It won't work. The alternative will not work if you don't do any of that. And so we do need the Department of Justice to come on board. If you look at their response in the white paper, they keep saying to be considered or under consideration or under review or will be reviewed in a year or two. That doesn't actually give us much hope in terms of ending the system of direct provision, because you will end up with a situation next year where we still have thousands of people waiting for a decision. Now countries are lifting the restrictions. You saw Ireland lifting the visa restrictions that were imposed on certain countries that didn't require a visa to come into Ireland. The number of people coming to seek asylum in Ireland will be peaking. I suspect that it will peak again as more countries open up travel, international travel. That, of course, will contribute to the backlogs that we already have. And we need to start implementing the recommendation by the Catherine Day Group to actually grant people who've been in the system for at least 2 years leave to remain so that they can get out of direct provision and be provided with support. Again, there is a lot of talk that people in direct provision with status stay longer because they can't find accommodation. They're not going to find accommodation if the state isn't investing in a capacity to actually absorb them from the system of direct provision now caused there. Thanks.
Thank you very much, Bulani. Thanks for that very much. I've made a note of your points: dispersal, control, right to work, poverty, space, power structures, the backlog, and the all or nothing nature of this issue. That unless we can make changes in the protection process, then the direct provision system will be harder, if not impossible, to change. So thank you very much, Bulani. Really important intervention. We're now going to move across to David Carroll. David is the CEO of DePaul. David has worked with DePaul since 2009. And I'm really looking forward to his presentation. Lots of ideas. I know we've spoken, communicated a lot. David's always presented an interest in this area for several years. So you're very welcome, David, and thanks for presenting.
Thanks, Nick. Thanks very much. First of all, congratulations for bringing together everybody. And I think what I have to say actually may summarize a lot of the issues that have been talked about. What I'm going to focus on specifically is phase 2 and the almost like the practical steps that we need to start to think about from an approved housing body perspective in order to be able to deliver. I think a lot of people today have come up with some really excellent suggestions. I think it's really good to hear that the housing agency, John and Julie, really touching on some of the specific challenges, I suppose, that need to be addressed if we're going to reach the targets of this specific provision of housing. And I think Orla's focus on urban regeneration is a really kind of positive step in this way. But I've learned a little bit on the report, your alternatives to accommodation report. And if we look at specific numbers that we need to think about in terms of what we need to bring on in phase 2, we probably are talking about 3,500 units, 3,000 to 3,500 units. And I suppose there's a specific question of what role bodies like ourselves and approved housing bodies have to bring that on. Looking at your reports, you do talk about approved housing bodies probably providing about 25% of that overall number as a goal and as an objective. And obviously the local authorities have a role, and there's a big question, I suppose, on what is the role of the private sector in all of this, considering I think all that's been happening in the last 4 or 5 weeks in terms of the role that the private sector has in long-term leases. So just to look at ourselves at the moment, we do provide a service funded by the Department for Children in reaching into direct provision centres, and it's aimed at working with people at the moment who have permission to remain, and we work with them in order to be able to provide accommodation within the community. And I would want to kind of say from the offset in the last 3 years that the vast majority of accommodation that has been provided has been through HAP and homeless HAP. And if we look at numbers, we've worked with in 2019 710, with 328 individuals moved on. 2020 442, and 2021 120 so far. And we work from Galway across to Dublin, and there definitely is. If you think about 2020, you know, even in that time, families and households and single people had great success in obtaining accommodation, but that is definitely slowing down in the first half of this year in terms of our ability to be able to free up accommodation for people to move on. And your figures at the start obviously demonstrate that really ably around the challenges that we have. So what I'm going to do is talk about, okay, if we're going to get a real kind of run at this, what did the programme board need to think about? I think it's just been talked about in the last presentation around the whole issue in terms of what are our expectations around spatial allocations, and are they going to be based on current housing association standards for family type owned or accommodation? But in specifically, as Bililani just talked about, in relation to single people, what is the role of shared accommodation? And what will be the ratios? What will be the expectations in terms of shared ensuite accommodation? Because I think if the approved housing bodies want to have a specific role, and this is hugely important from the very beginning, that we don't, that we do, that we're very, very clear around the standards that are set down in terms of what actual accommodation that's going to be put forward as part of phase 2. Going on then to capital development financial mechanisms, and John and Julie have talked about this, and the white paper talks about this replicate on your own paper, the replication of CAF and CAS type arrangements. And we need clear guidance on the qualifying criteria. But I think first of all, the Department of Children need at this moment in time to be very, very clear of what is their budget allocation against this. And also as well, if there's going to be a replication of systems, that those mechanisms are actually put into place. There's a question on the guidance around joint funding applications between the Department of Housing and the Department of Children. So a scenario around that might be the development of a social housing programme, say 100 units. Will there be an allocation, or will there be thoughts about allocation towards phase 2 as part of that? But that means a hybrid approach to the funding application between Department of Housing and Department of Children. How is that going to be managed, and how do approved housing bodies work on those kind of joint funded streams? Absolutely can be overcome, and just that system needs to be in place. Issue around the finance for the purpose set out, and I listened to Orla earlier on talking about the flexible use of properties going forward, But if you look at allocations, say through CAS, there's a defined use for that for support and accommodation. If you define the use of a property at the moment for phase 2, and we make the decision that it's appropriate for that family or household to remain in that property, we need scope around that. And therefore, will there be provision around the change of use if the property is to revert to generic social housing provision? For whatever reason, a property may need to return to social housing, and we need to be clear as an approved housing body around that. Will there go for long-term leasing arrangements, and will the approved housing bodies have scope within that in terms of this? Clearly, housing dispersal and planning is something that we all consider, both for the individuals themselves. You know, property and housing needs to be in place that has access to schools, to community resources, to employment. At the moment, for instance, we are working with families who have challenges and single people who are in kind of regional and rural areas around access to say creche facilities, where they might be in a HAP property 2 or 3 miles from a town centre. So the quantum of housing in what areas, I think, is really an important focus and access. I think it's much for the local authorities as well to be able to kind of have a responsibility on what they need to provide, and to avoid an over concentration in specific areas. And the question around the current planned housing programme and how that is going to be designated. Again, we do have this challenge in terms of this perception around competing needs for people who are on the general social housing list. But there is an opportunity to use social housing programs. I think if we manage this properly, to be able to use it in such a way that some housing is designated toward in larger pieces. Nick, you talked about the Land Development Agency already. We need to think about the fact that we don't want to ghettoize specific properties either. So how that is planned, how that's managed, and the management of the overall kind of competing demands is a key consideration. Housing management funding. For the approved housing body, rents, you know, if you as an approved housing body decide to enter into this, where's the rent coming from? What level of rent will be set, and what will be the payment methods with regards to that? Because obviously people, well, and that goes back, will this be a direct payment system from the individual themselves who will pay the rent to the approved housing body, or will this be a direct payment system straight to the approved housing body? We do need, and this is from our experience around supported accommodation. So this is any supported accommodation that anybody runs, it can be increased wear and tear and facilities management. So we do need to think in terms of when rent levels are being set in order to be able to secure the sustainability of any properties that we have taken forward, that wear and tear is taken into consideration, and that whole area around sinking funds and the development of sinking funds as well. The whole question around license and tenancy management as well. Again, will there be scope for change of use of the properties? Inevitably, people will be asked to move on in certain circumstances, the management of those issues. How do we avoid the approach to phase 2 but silting up? You know, if we agree on a quantum that needs to be provided as part of phase 2 over a period of time, it does mean that housing has to be created within the community for people to move to, or if that particular housing is maintained for people as a social housing piece. What's the renewal? What's the replication policy? And then the central placement system and management of individuals who come out of phase one, are allocated a property, allocated a tenancy or a license. How are we going to manage that? And then finally, the support infrastructure. We do have this piece around, and Bulelani talked earlier on around independence, you know, and versus the vulnerability, and inevitably there are families and households within the existing asylum seeking population who will require support. So what is that housing management piece versus care and support? That vulnerable households and how we support them versus low need household support. So there may be people in employment, education, but there is a housing officer role that needs to be taken into account, and on dealing with getting their plumbing fixed, fixing the front door, fixing the broken window, heat, light, and household billing. Again, key issue: who's going to pay for the electricity? Who's going to pay for the heat? Again, is that a direct payment, or does that come directly to the approved housing body through the state? The issue again around poverty and household financial welfare is a key issue. I've spoken already around phase two move on support as well. There has to be a layer of support, and we're centrally involved in that, and different people on from direct provision centres and emergency accommodation at the moment. There needs to be obviously a layer of support networks in order to be able to enable people to move on from phase two, and the whole kind of piece around legal, vocational, educational that Nick, I know you and others are absolutely embedded within. Okay, so that's my thoughts.
David, thank you very much indeed. That's a really forensic analysis and setting out of I think the first of the agenda of the program board's first meeting. I think these are the questions that everybody has to get their heads around and have answers to. So thank you very much for that. Our final speaker this afternoon is Andy Gale. Andy is a housing consultant and expert from the United Kingdom. Andy was really helpful in supporting us and giving insight and expertise into our report that we published in January on implementing alternatives to direct provision. He's got a huge amount of experience in housing, but also housing for people seeking protection. So really looking forward to what Andy can bring, and suggestions and advice and observations, including from the lens of the experience of the UK. So Andy, thanks very much for joining us. I know you're very busy, so I'm going to pass across to you now.
Thank you very much, Nick, and it's great to be with you all. It's 21 years and 2 months since the UK Asylum Dispersal System started in April 2000 with the National Asylum Support Service. I'm aware of it fully. I was seconded into that organisation in 2000 as the head of casework. And I suppose my short presentation, well, it's not a presentation in slides, but my presentation is, if you get it wrong at the start on a dispersal system, then there's no way back for you. And I think 21 years on, the principle behind that system to start with, which was your own, not so much your own front door, families had self-contained accommodation, but for single people, it might have been a room which had cooking facilities or not, as the case may be. You may have had your own front door and self-contained, but the whole thing around that dispersal model, one of the few dispersal models, the English model, the UK model, one of the first few dispersal models in Europe, and they got it wrong. badly wrong. And I want to give you a flavour of the lessons from the UK dispersal model. Now, asylum dispersal and accommodation continues to be controversial in the UK. So in the last 2 weeks, we have had a High Court decision in the UK against the Home Office for using an ex-army barracks in Folkestone in Kent as a reception centre for, not for a few weeks, but for months and months. There were no leisure facilities, people within dormitories, there was an outbreak of COVID, and the government lost a case with injuncted, and there may be damages as a result. Only 2 days ago, Kent County Council decided to stop taking any more unaccompanied minors. So the position had been that if people were coming through the ports of Dover, that they would go to Kent Children's Services and be accommodated, and Kent are full and have now looked to injunct the government because they can take no more cases. So it continues to be controversial. So let's take you back 21 years and just give you a flavour of the original intentions and then how the whole thing worked out. So 21 years ago, there was a principle established, had been established 2 years previously, that there would be an asylum dispersal system, but it would be a fair and equitable system. There was a paper produced by the government that people would be equally distributed across the UK. It wouldn't matter if it was in higher cost areas or lower cost areas, that integration would be a guiding principle behind that, and that no one area would have to take too much of a strain, and that the system would be developed with local authorities. So before 2000, local authorities were responsible for accommodating asylum seekers, and there were only two criticisms of that system, really. The first criticism was there was not enough government grant for the accommodation. And the second criticism was it was not an equitable distribution. So many councils in London took the majority of asylum seekers and had to accommodate. Now, the government, instead of fixing the system as it stood before 2000, made a bold decision that they would centralise the system. They would set up a new organisation in the Home Office called the National Asylum Support Service, NAS, and that would deal with accommodation and subsistence. So the early principles of fair and equitable distribution were lost immediately. Overnight, it appeared, there were two principles that came into the system. The first principle was that price was everything. So the price of the accommodation would determine who got the contracts for the accommodation. And local authorities and what we call, you call approved housing bodies, we call housing associations in the UK, local authorities and housing associations were being treated exactly the same as any other private sector provider. If you wanted to bid for the accommodation, you could on the same terms, and the price of the accommodation would be far more weighted than the quality of the accommodation. The second thing that seemed to change was that asylum dispersal as a principle should be used as a deterrent. So it was a clear policy in the UK that dispersal should be a deterrent, that people should not be allowed to remain in London and the South East, but they should be dispersed to areas that they would not like to go. That was the fundamental principle behind it. And that's exactly, therefore, what happened. So contracts were sent out in 1999 and contracts came back. And what you had was private sector providers bidding for those contracts and the government, the Home Office took those contracts based on the lowest price. Now, what that meant was that dispersal accommodation wasn't national, equally across the UK. It was predominantly in the north of England and in Glasgow. So you had accommodation in the north of the UK and Glasgow. Accommodation was procured by the private providers cheaply. And of course, if it was cheaply, it was in the areas which were the most deprived. So the areas that were most deprived ended up taking the burden, for want of a better word, of additional people who were vulnerable and needed support. So the poorest areas took the strain of the dispersal. It was worse than that, because the original position in the UK was that people would only be given vouchers, and that accommodation had to be with 1 mile walking distance of a post office, so that they could actually collect their vouchers from the local post office. So what you had was clusters of accommodation. And in terms of a message for integration, you know, on the Wednesday, there are 2 elderly people collecting their pension from the post office. And with no warning, on the Thursday, there are 200 single people queuing up for their vouchers at the very same post office. And what sort of message does that actually give? Now, there has been never a way back from that. So we have now had 4 rounds of contracts, and yet in effect, we don't have a national dispersal system. We have a system in the north of England, the northwest, the northeast, some in Yorkshire and Humberside, and in Glasgow. So in Glasgow, tower blocks that have been emptied out because nobody wanted to live with them were then used for asylum seekers as a money-making venture for the local council. Housing associations out of the picture, virtually no housing association provision. Local authorities didn't even bid for the accommodation contracts because they felt so excluded from it. The Home Office came back to local authorities, and for a short while there were some small accommodation contracts, but it was basically led by the private sector. All that opportunity, a partnership approach, 50% of the social housing stock in the UK is owned by housing associations. They were ruled out of the picture. The rest of the stock by local authorities ruled out of the picture. The voluntary sector with specialist accommodation schemes for people who are vulnerable with complex needs ruled out of the picture. Furthermore, those contracts then with the private sector providers, the wraparound services around linking them into local services was a small part of the price that was paid and was the responsibility of the provider themselves. So this is how it all began. A national dispersal system became a system to the poorest areas of the UK and within a mile of a post office of those poorer areas of the UK. Now, what then developed on was that the new National Asylum Support Service, NAS, centralised all operations. So the process within the UK was there were reception centres run by the voluntary sector, and those voluntary sector organisations were tasked with taking on hotels and other centres, some in Kent, many in London, and people were only given, so the whole process was built on 7 to 10 days turnaround, not 4 months turnaround, but 7 to 10 days. So within arriving in the UK, you could be expected to be dispersed within 7 to 10 days. There was no vulnerability assessments, people who were victims of torture, people that had special needs, mental health situations, none of that mattered. There were no assessments. You were dispersed within 7 to 10 days. Not surprisingly, that system started to break down very quickly. 2 weeks before the start of NAS in April 2000, there was no coach contract. The intention of the UK government was to give people a rail ticket and a map to King's Cross, and then expect them to find their way to King's Cross on a train and find their way to the accommodation providers at the other end. Unsurprisingly, that failed. Coach contracts, emergency coach contracts were brought on, and teams of people were sent from the Home Office to the reception centres to knock people up in the morning with no notice at all. You're on a list, you're on a bus, and you're going to Newcastle, you're going to Gateshead, you're going to somewhere that you've never heard of. Unsurprisingly, some people refused to go. Support was withdrawn for very many cases. There was no dignity within that system. People weren't consulted. And if you contrast that with the main system, so I work in the UK with local authorities on homelessness, And if you are a homeless family that is provided with temporary accommodation, you have a right of review. It's a legal right of review. You will have a right to be consulted on where that accommodation should be. You don't have an ultimate right to refuse it, but accommodation is managed with you. There has to be a full assessment of your housing and support needs before the accommodation is allocated, and the location has to take into account communities and community support. None of that for asylum seekers. It's a bus, it's someone you've never heard of, and you're going today. And that was the system that was operated. No choice, centrally controlled. No attempt really, other than lip service, to involve local authorities. So it is only now, some 20 years on, that there is now finally with some teeth, local authorities can impose or negotiate with the Home Office a cap on the number of asylum seekers in an area. In principle, there'd been a cap early on, but it was never enforced, and therefore areas took, the poorest areas took way more. There was no question of a cap or anything else. It wasn't just the allocations that were made centrally, and I know in the Catherine Day report, that was one of the issues around a matching service. Can I assure you that a centrally matching service just does not work and will never work? Any form of, in terms of what the right accommodation is for someone, needs to be based on a proper assessment of people's housing needs and support needs and vulnerabilities, and that accommodation matching decisions need to be made locally and in conjunction and in consultation with the person, not imposed on that person. But it didn't stop there. So there was the question of how do you check and manage that accommodation from the private sector providers. So teams were set up in Croydon, that's where the Home Office is based for asylum. Teams were sent out on a daily basis to the regions, and most of those teams came back the same day. So you get on a train, it might take you 4 hours to get to the north of England. You could inspect 2 properties, then you were back on a train back to London, and off you go again the next day. So there was no local control of that accommodation standard. Unsurprisingly, it was poor standard in many cases. There were poor practices. In the UK, there was a big kerfuffle a couple of years ago with a private sector provider painting the door of all asylum accommodation red in Middlesbrough, so people were easily identified through the red doors that they'd actually got. Now, something the UK did do on the after the first 2 contract rounds was to make the contract much tighter. Now, the argument was they made it too tight. So the initial contract lost the UK government lots of money because the initial contract was based on full voids paid. So it was a block booking arrangement. We pay for the accommodation. So the UK government paid over the top for the price and paid whether the accommodation was occupied or not. Now, the third contract award and the contracts that operate at the moment are much tighter than that. So voids aren't paid for, and you know, the price is right and voids aren't paid for. It's still virtually 90% private sector contracts. But what that's done is then drive the profit down. So, you know, it's hard to be entirely sympathetic to G4S and Serco, but there's an element of being sympathetic in that they felt that the asylum contract system provision was a license to print money. And G4S lost £57 million on the asylum contracts, and Serco, who are still providing contracts now, estimated that their losses are 110 million. So if you're going to have a contract, it has to have the right price, it has to provide value for money, but it can't drive providers out of the market, because even the biggest providers of G4S and Serco look as though they may walk away from asylum contracts. And then who will pick that up? Private sector is part of the solution. It has to be part of the solution with local authorities and housing associations and the third sector. The problem is when it becomes the main solution. So people had delays on their applications, but of course, eventually people got a decision on their asylum application. They had been dispersed to areas they had tried to settle, they couldn't work within those areas. But at the point they then received a decision on their application, you had this problem. If you received a negative decision on your asylum application, you still had accommodation. So under what was called Section 4 support in the UK, you would be provided with accommodation until a final decision had been made on your asylum application. However, if you received a positive decision and were granted refugee status, then you had 14 days to leave the accommodation. And for many of the people dispersed were single people, not families. And the UK homelessness system only provides a legal duty to provide temporary accommodation if to families, pregnant women, and single people who are deemed as extremely vulnerable. Case law has established that being an asylum seeker on its own does not pass the vulnerability test. So you receive a positive decision, you have refugee status, welcome to the UK, you're on the streets in 14 days' time if you're single. Now, to the absolute credit of local authorities, because I think many local authorities have been absolutely contemptuous of the Home Office in the UK. They haven't been consulted, they haven't been involved, they've had the system imposed on them. But to their absolute credit, they have worked so hard to provide accommodation options for asylum seekers who have received refugee status. Many have provided temporary accommodation, even though there isn't a legal duty to provide that temporary accommodation. Many have put their own money into integration plans and back in the voluntary sector. The money, pitiful money, has come from the Home Office to the third sector or for local authorities to provide integration support. So people in effect have to become homeless in order, once they receive refugee status, in order to access any form of accommodation. So to finish, what would my messages be? Because I've talked a lot about a system that 21 years ago, the UK has never recovered from. And the irony is, and the shame is, it could have really worked well. As a national dispersal system where there was equity where people were placed, it could have worked extremely well, but it didn't. And there was no way back for the UK 21 years on. So what are my messages? Devolve commissioning of accommodation, even if the purse strings are held by central government. The decisions around what's right to commission and the balance between the different types of accommodation, that has to be localized decision making. Involve all of the players, the housing associations, so in Ireland, the approved housing bodies, the housing associations, the local authorities, the third sector, the some of the excellent hosting schemes which have been talked about. All sectors have a part to play in the accommodation solution. Involve asylum seekers in the decision making. You cannot impose decisions with no choice, no appeal rights, no assessment of needs, no vulnerability. It's not a deterrent, and it didn't act as a deterrent in the UK. The Home Office hoped that messages would go back home. Don't come to the UK because you'll be dispersed to somewhere you don't want to go. That didn't work. And actually, it should be a positive choice when people are dispersed and a positive experience, not something that is meant to be acting as a deterrent. Contracts, yes, the European rules on tendering, but price is important, but so is quality of the accommodation and what wraparound services look like. So there should be an equal balance between quality and price. And if you get that wrong, you end up paying more money anyway through all the fallout that actually happens. Planned moves. So should somebody be made homeless in order to try and get accommodation support, we have to treat former asylum seekers the same way, equitably, with people who are homeless, but they're not treated equally at the moment. And in the homelessness world, you try and plan moves, you try and prevent homelessness. And asylum seekers who get refugee status should be given the same rights of planned moves and a focus on preventing homelessness, the same as anyone else. The system has to be seen to be fair by asylum seekers themselves, by local authorities, and by host communities. If they don't perceive the system to be fair, then they won't support. The one message, I suppose, of hope from the UK, and it's nothing to do with the actions of the Home Office, and I'll finish on this, is that, and I'll illustrate it from a conversation I had with somebody that was Director of Equalities in Hull City Council. So Hull Council is on the east coast of England, in the north, incredibly deprived area. And Hull Council in 2000, where it was something like 98% white British, overnight received hundreds, which then grew to several thousand asylum seekers from all over the world. And you can imagine the position in Hull, where 98% white British, with no planning, literally no notification, post offices queued of people trying to get vouchers. You could imagine how that played at a local level. There was a huge amount of publicity, radio, local press, and so on. I went back to Hull just before the pandemic, and you walk around several areas of Hull, which 20 years ago were deprived, with shops and houses that were empty and boarded up. And now you have restaurants, from Kurdish restaurants, people from Iran running businesses, and the integration that's gone on in somewhere like Hull is something that's being replicated largely right across the north of England. The north of England, people from the north are known as being friendly. They may well be known as the people in Ireland as being friendly in many parts of Ireland, far more friendly than people in London and the southeast. But despite the Home Office and the system, asylum seekers were largely welcomed with open arms in those communities. And having got refugee status, have set up businesses, are employed, have set up restaurants, and actually contributing significantly to the culture of those communities. So there is hope, and it can work despite every attempt of the UK government to make sure that it doesn't work. That's all I've got to say, but thank you very much for listening to that.
That's fantastic, Andy. Thanks very much. A sort of sobering walk through the UK process, so much to learn, but good to finish on a positive final note. I think there was some disquiet, including from ourselves, about the idea that the white paper kicked a few things down the road. But what you said at the very beginning about making sure you get things right from the very beginning, I think is important. And so perhaps some sort of pause before implementation is important. So thank you very much for that, Andy. Andy was, again, as I said at the beginning, very much involved in the paper that Campbell to Gale produced, put a lot of ideas into that. So check that paper for